Okay, hi everyone, and welcome again to this evening's presentation on choosing health profession schools. I'm Dr. Amanda Dye, the Director of Advising and Programs at Beyond Barnard, and I'm looking forward to talking a little bit about how to understand creating a list of professional programs to apply to. So to get us started, I'm going to share my presentation and we'll go from there. Again, we're talking today about how to prepare your application and how to choose a list of schools that are appropriate for you to apply to and hopefully interesting and exciting for you to apply to as well. Today, I'm hoping that we can spend a little time considering some of the very large categories of factors, as well as give you some suggestions of very, very detailed kind of fine print factors that could influence your decisions in terms of building your list. We will do in the core of the program some practice evaluating different schools using some case studies. So I'll talk you through how I understand these schools based on information that is publicly available online. So, kind of understanding how can you assess programs. And then to wrap it up, we'll talk a little bit about some resources that can help you as you are searching for programs and creating that list. I want to preface this by saying I'm going to focus mostly on the case studies are going to focus on medical schools since that's the largest group of our applicants. But I think that a lot of the factors that we're going to talk about in this next section are applicable to a wide range of programs. So we'll first start with how do you figure out what's important to you? And then we'll do the case studies and then we'll talk about some resources, FAQs, lots of things like that. So, when you're thinking about choosing health professions programs, obviously these are professional programs. So you want to think a little bit about your career and the kinds of things that you are most interested in. I think this is true for all kinds of healthcare, right? You could be interested in much more of a primary care profession, or you could be interested in an education in a specialized kind of care. And both of those things are things that you can consider for your initial health professions degree. Things like urban versus rural practice apply to everyone. Things like, do I want to work in an academic context or a private practice kind of a context, can apply to everyone, as can research orientation. Are you a person who's interested in pursuing research as part of your career? And if so, is that something that you want to have as part of your professional education? It's also really important to think about, the match between you and the institution's mission. Are there goals that you and the institutions that you're considering have in common? Are there things about your interest in healthcare that are really highlighted by particular schools? And those are definitely things that everyone can think about. For those who are thinking about medicine in particular, relationships with or kind of record of placement in residency programs is also definitely something that you can consider at this stage. If you know that a medical school has a lot of strength in sending people into a particular residency, and that pathway is one that's really appealing to you, it's something that you could consider at this stage. But going beyond those big career goals, you also want to think about how a school actually does its education. So, in any given health profession, the actual education, the things that you have to learn, is pretty tightly regulated and quite standardized. This is important because, diseases work in particular ways. The human body works in particular ways. And so the core of what you're learning in any given health professions degree should be really similar to what you're learning, across the board in any school. However, different schools break up their curricula in different ways. Different schools definitely make electives available in different ways. And so things that you consider are, beyond the basic curriculum, what are the extra things you're going to be able to learn? What are longitudinal patient care experiences like? Are you going to be able to start connecting with patients from your first semester in the program? Does the school use what's called a problem-based learning model? So problem-based learning is a model of health professions education in which you would be placed in a small group, maybe like 9 to 10 students. Usually you'd have a preceptor who's a clinical instructor, and you would be tasked with, figuring out a clinical scenario, working together collaboratively, like a healthcare team does, to figure out how to treat, a hypothetical patient or something of that nature. So small group learning, like really, really interactive learning, is that a big part of the curriculum, or is it more kind of a lecture thing? Does the school make it possible for you to observe professionals in their career or other kinds of preceptorships? Are you going to be able to, outside of the curriculum itself, find time to connect with clinical faculty members and, learn more about what they do? Does the school offer a lot of standardized patient interactions, or even, a lot of schools have clinical skills centers where there are very fancy robots these days? Do you feel more comfortable practicing on a fancy robot first? Or are you interested in, standardized patient interactions with human actors who are usually, people who are pretending to have an illness? What about things like sub-internships, things where, in the curriculum, you're going to be able to do some more advanced clinical training, maybe look at, sort of specialized areas of interest for yourself. Overall, in the educational program, a lot of things that you can consider are things like, how does the teaching happen? Is it mostly is it mostly lectures? If so, are the lectures recorded? Is attendance required? Are there special programs, including dual degree options, that would be interesting to you? Many people are interested in, something like an MD MPH pathway, or an MD MBA if you're someone who's interested more in like healthcare administration and maybe like health business. So those kinds of options you don't necessarily have to apply to upfront, but are they available? Within the educational program for the MD, are there special tracks that maybe appeal to you? Are there ways to graduate with like honors in research or service? How flexible is the coursework, and what does the timing look like in both the preclinical and the clinical years? How do standardized tests work? Are you going to be taking your licensure exams? If you're applying for medical school, you have to take several. So step 1 and step 2, are those taken at very specific times? Do you have protected time to prepare for those? If you're looking at a newer school, or a school that has had any history of probation with its accreditation association, and what's the status? So if you're looking at a newer school, it's important to know that no health professions program can be fully accredited in the US until it graduates its first class of students. So it's reasonable to consider whether a newer school is a good fit for you, but it's good to know kind of where a school is in its process. Of course, you want to think about like, what are rates of passing those national exams? Those are always going to be a factor for health professions, regardless of which profession it is. And many schools will publish things like their first time pass rates. You can also learn a lot about like, how does the school do grading, which is very important. Many professional programs use a pass-fail model for preclinical and some kind of graded model for clinical education. It can vary a lot, and it can make a difference to your experience as a student. So I just want to give a couple of examples really quickly. This is a visual representation of a curriculum for Sidney Kimmel Medical College, which is the medical college at Thomas Jefferson University in Philadelphia. And you can see that the sort of the blue parts of the curriculum, that's their basic science curriculum. So that part of the curriculum is 21 months, so a little under 2 years, but there are vacations built into that time. And also you can see at the end of that, the sort of the blue bars, there's specific time to prepare for step 1 of the USMLE. And you can see that, a lot of these, the first year and a half or so, sort of very typical things that you would imagine in medical education, some systems-based education, time for particular exams and anatomy and things like that. You have the time to study for and take the step 1, and then the clinical clerkships go on for almost a year. And you can see that there are different big sections that everybody has to meet. So internal medicine, neurology, surgery, emergency medicine, a surgical subspecialty selective, family medicine, psychiatry, and OBGYN and pediatrics. These are clinical clerkships that everyone is going to go through. And then in the third phase of education, which is the last little under a year, is what they call differentiation. So that's where you're doing electives, including sub-internships that will help you to learn more about the specialty that you're moving toward. So as you can see, there are elements of the curriculum that are woven entirely through it. The sort of burgundy bar at the very bottom, scholarly inquiry, that's present in every year. So you're always going to be doing something as part of the scholarly inquiry program, even though you're not always going to be in a basic science curriculum. And for contrast, this is the recently revised curriculum from Duke School of Medicine. So you can see that there are really similar elements here, right? But it's broken up in different ways. So the preclinical curriculum, that basic science stuff, the systems-based things, these are happening all in the space of that first year, the bar that's blue at the top. Then you go into the clerkships during the second year, and as you can see, it's the same kinds of topics, right? Peds and OB-GYN, surgery. And so you're seeing a lot of the same general stuff. Duke requires a year of scholarly, or somewhere between 10 and 12 months of scholarly work. So you get a protected third year, essentially, to create some sort of a scholarly project. There's a great deal of latitude in terms of what that is. And then similar to Sydney Kimmel, you'll see that you're finishing up your education with electives, various clinical kinds. There's a capstone project, etc. So as you can see, right, schools have essentially to teach you the same things, and the elements of the education are going to be quite similar, but the way that it's broken up is going to be different from school to school. And one version of medical education might be more appealing to you than another for whatever reason. So it's really good to investigate curricula and kind of think about, okay, what would it be like for me to do medical school this way? Research comes up a ton. So many students at Barnard are interested in research. And I think, considering your past research experiences and whether that's something that you really want to do in the future is important. So that you can investigate whether a school has funding or specific protected time, as we saw in the case of Duke. What are also, policies for taking time off? It's not uncommon these days for people to take a research year between year 3 and year 4 of medical school to do research before entering into the residency application process. This is particularly common for folks who are interested in relatively research heavy or very competitive residency options. So, learning a little bit more about what does this look like? How common is research? Is this something that, I want to prioritize as part of my education? If you are a person who's really, really sure that research is a primary part of your career moving forward, and you're looking at, for example, MD, PhD programs, I'm going to give you some special advice here. So for folks who are interested in MD programs, you don't have to listen to this, but MD, PhD, the most important thing is understanding your own research program. What is it that you want to accomplish as a PhD student? Because that is the only way you are going to be able to choose programs that are a good fit for you. You want to be able to assess how many faculty work in or adjacent to your area of interest, and how familiar you are with their work. Looking for MD, PhD programs where there are people whose work you have cited is a really good way to start thinking about this process. You should also consider, because most MD, PhD programs are very small, how many students are typically admitted per year and how many of those are working on things that are kind of adjacent to your area of interest. I think that that's important because people often find that their colleagues in a PhD program are important for like bouncing ideas off one another and for helping to develop the work. So ideally, you want to be in a place where there's a community of other scholars that you're going to be able to build with. You should also think about things like, what are the resources in terms of facilities or institutional affiliations that a particular program has. You can think about funding structure and sources. If you have heard the terminology MSTP, or Medical Scientist Training Program, that is a designation that indicates that a program has a particular kind of federal funding to fund its MD, PhD students. It doesn't mean that it's necessarily a better kind of program. An MD, PhD program could have privately funded through philanthropy, their MD PhD program, and that could still be a good fit for you. The MSTP is really just about where the funding comes from. You should also consider like what the MD PhD experience looks like at a given school. Typically, you're going to start in the MD curriculum and complete the preclinical parts of your curriculum, then hit pause, finish and graduate with the PhD and come back to do clinical education. But it's really important to understand how that would work. It's also good to investigate average time to degree. So nationwide, I think it's around 8 to 9 years is maybe that's the ideal. Probably 9 is closer to the average, if not a little higher. But you want to know, how does it look for people to actually complete this program? In terms of other facilities for anybody, a medical school is going to be a big piece of your world. A professional school in general, like a lot of your life is going to be centered on your program. So knowing about like, is there a physical library? How will you access resources? What kinds of spaces are there for students, especially if you're considering schools in urban areas? As you know, having gone to Barnard, it's a small campus. There's not a ton of space. So understanding like, will there be places for me to be able to gather, have study groups, things like that? Gym, if you're interested, or other kinds of facilities, right? Are you going to be close to an undergraduate campus as well and have access to those resources? Are you going to be kind of separated from an undergraduate campus? You should think about what technology you need and what technology will be provided. You should also think about like, where are the clinical sites that you'll be doing your clerkships and other parts of your clinical education? Are there different kinds of sites, including the ones that are listed here? Are you going to be mostly at one main teaching hospital, or are there possibilities to do away rotations in other cities, states, even countries? Do you need a car? And if you do have to use a car, are you going to have access to parking, near your hospital/campus? Lots of really practical things are important to consider. Student services are also huge and sometimes really, really hard to assess from the information online. But things that I always encourage people to consider is, what does the advising look like? I mean that in terms of academic advising, making sure that you are going to get through your program, but also, individual like mental health counseling. What are the wellness services like? Are there financial advisors? For most people, medical school is a big financial investment. And so you want to know, does the school provide you resources on like figuring out what your budget is going to look like as a resident or as a young professional if you are, pursuing a program that doesn't have a residency? What does career advising look like? If you're looking at a professional degree, it's really important to have access to career services that are very specific to that kind of degree program. And is access to these services included in your tuition or service fees? What does mentorship look like? Are there student mentorship networks? Are there formal or informal networks between faculty and students? Who does the advising? Those are really good questions to ask. In terms of policies, this is super granular stuff, but things that you can consider are like, how are academics evaluated? Is it pass fail? What about clinical evaluations? How do those work? Are there mechanisms for students to give feedback to their instructors? What does the honor code look like? And is there a process for grievances if necessary? What do opportunities look like to do away rotations, as I mentioned before? What is the medical insurance cost? Typically, medical schools will require you to have a pretty particular kind of insurance. So understanding what that looks like and what the cost of it is, as well as policies in terms of exposure to infectious disease, which is a little like it sounds super specific, but is a reality of clinical education. You also want to consider who else would be your fellow students. Obviously, it makes a difference to go to a school where you feel like you are part of a community and that you can take an active role in that community. So things like the diversity of the medical school, availability of support services or organizations for students from underrepresented backgrounds. Does the school have academic or other committees that have student representation? So like if there's a curriculum committee, are students on it? If there's a committee on, sort of general decision making, are students there? What's the level of involvement with community service and what kind of opportunities are there? Is there a student government and how do students get involved? How many and what kinds of active student organizations are there? And do they align with things that you would be excited to be involved with as a student? Location, I come to close to the end because I think it's fairly obvious. Everyone thinks about location, and I think that, you know, considering the proximity of a medical school to your support networks is very important. Considering state of residence is also important when you're applying to public schools. Some states in the United States do not have their own professional programs. And so, for example, many states in the sort of upper western part of the country do not have medical schools, but there is a consortium program so that the University of Washington acts as a public medical school for residents not only of Washington, but Wyoming, Alaska, Montana, and Idaho, the latter four of which don't have their own medical school. And similarly, I think it's actually Sidney Kimmel is technically the like state school for residents of Delaware. So they have a special program that's sponsored by the government of Delaware because Delaware does not have a medical school inside the state. Sidney Kimmel in Philadelphia kind of has a program to set aside up to 20 seats a year for Delaware residents. Things like, you know, campus location, rural versus urban, super important. You can consider, of course, your geographic preferences long-term. So if your preference is that you know you want to be working, practicing your profession in an urban area, it's reasonable to look for options to be educated in an urban area, even if, you know, you ultimately end up attending school in Chicago, but then coming back to practice here in New York. You want to think about the availability of clinical sites that match your interests. If you're a person who's coming into professional education with a really strong interest in oncology, are you going to be able to train in well-known cancer care centers as a student at this institution? Those are things that can make a difference. Also, things like the cohort size, so the number of people that are admitted each year, as well as the total number of students in the school, and other programs that the school might have. So many medical schools are closely affiliated and share campuses with other health professions schools. So like, for example, up here, I'm in Washington Heights, so up here where Columbia's medical school is, there's also the physical therapy school, dentistry, nursing, a lot of health professions programs kind of all in the same place. Is that something that's interesting to you? You know, are you looking for a larger health sciences university? Of course, the money is really, really important to consider. So you want to think about things like what are the tuition and fees? Typically and generally speaking, if you've got access to a public medical school, that's going to be one of the most affordable options if you are an in-state candidate. But of course, there are schools that, as very famously, have debt-free or loan-free or tuition-free programs. Many of you may have heard actually last night, Albert Einstein College of Medicine in the Bronx announced that it had been given $1 billion, which is wild. Nobody's ever given $1 billion to a medical school before, and they're no longer going to charge tuition. And that's a fantastic thing, right? It is amazing to be able to have the opportunity to apply to programs that make medical education much more affordable. And so, you know, that trend started several years ago, and definitely there are schools who are, you know, kind of coming on board. But in the meantime, most people are going to have to be applying to a mix of schools, some of which have really, really generous financial aid policies, and some of which, you know, have a relatively high degree of debt. If you are married or plan to be married before you start, or if you have any children, thinking about things like whether those folks are considered in your financial aid packaging, and whether the school makes housing available, if they provide any subsidies, like do they own buildings where students can live and pay a below market rate rent? Do they consider housing costs in your financial aid package? Again, the availability of financial counseling, you know, will you be able to have access to staff who can talk you through these things is really important, as well as counseling, you know, as you get closer to graduation, when it comes to figuring out how you're going to live on your first salary out of professional education. Okay, so that's a ton of different things. And what I want to do in this next section is to talk you through a set of 8 medical schools that I just sort of have pulled data on. And I want to talk you through what I can learn about them from the sources that are publicly available, things that, you know, you can do even without having visited a school or having a lot of experience with a school. And so we'll talk about some of these factors that I have mentioned as we're moving through. So this is the list. I have 4 private schools and 4 public schools. I tried with the private schools to represent lots of different areas of the United States. The public schools, I focus mostly on the Northeast, so New York, Connecticut, and New Jersey, since so many folks are from this region. But I've also got an example from a school out west so that we can see some contrast, because I think there are some important patterns, trends for you to know. So starting out with Columbia. Here is some of the data. Keeping in mind that the data that we'll be seeing here is for the class that entered in fall 2022. The data for folks who entered this past fall 2023 will be published in the next month or so. Usually by mid-April, it's up. But for now, we can take a look at the 2022 entrants. And as you can see, Columbia got a little over 7,000 applications, and it interviewed a little under 12% of its applicants for eventually a class of 138 people. Columbia does not participate in an early decision program, so nobody comes through mechanisms like that. But the medical school does have a pretty robust MD PhD program. So of those 138 medical students, 14 are joining the MD PhD program. And that is, frankly, a pretty large number. You can also see that Columbia admitted 1 international student, or well, 1 international student matriculated to Columbia. They interviewed 9 international students, so it's not a ton of people. About 11% of the folks in the class self-identified as disadvantaged through the AMCAS application. A little more than half are women. And the highest estimate for members of the class who are underrepresented in medicine is around a third. The average graduate debt is relatively low for Columbia because they do have a no loan policy when it comes to tuition. My guess is that some of the debt here is coming from like cost of living and things like that. And then down at the bottom, I have included information about the medians. So the things in the gray circles are the median numbers. And then the bands are the 10th to 90th percentile. So that's the lighter color band for each of these metrics. And the darker colored band is the 25th to 75th percentile. So that's the middle 50% of people who are admitted. And as you can see, they're pretty narrow for Columbia. So one thing that you can learn about Columbia is, all right, they're pretty particular about GPA and MCAT score, and there's not a ton of flexibility in those numbers in their admissions process. What else can we learn about it? So looking at the curriculum, the website, things to know about Columbia, they require a scholarly project, as many schools do. So that's a plus for people who know that they like research and like doing that kind of independent scholarly work. They also have a special program, the Columbia Bassett program, that is a collaboration with a healthcare network near Cooperstown in upstate. It's focused on healthcare management and rural health. So even though Columbia itself is based in a very urban place, there is an opportunity for people who are interested in rural medicine to get very specialized training. It's a small program. It's open only to 10 students a year. However, Columbia has a bunch of different dual degree programs. So it's a place that's appealing to people who are interested in a lot of combinations of other fields with medicine. It's also a really interesting place because, Columbia is a very well-known international medical center, but it is also the local hospital for those of us who live up here in Washington Heights. And this is an incredibly diverse neighborhood. This is not the highest income neighborhood in the city. And so a lot of different people, a lot of different kinds of patients intersect in that hospital system. And you can see a couple of quotes here in terms of what the school says about itself. So it specifically talks about its students preparing to be leaders in medicine. So that's really important, leadership and capacity to be a leader and a change maker. Those are things that they're looking for in the admissions process. And you can see also that they're talking in the second quotation about, science, research, and technology as being important in combination with compassion and listening. So they're trying to sort of intersect both the sort of art and science of medicine. Okay, so having looked at one school, what's different when you start to look at others? So the second program that I want to look at is Tulane University, which is down in New Orleans. And as you can see, they had a lot of applications. So Columbia was somewhere around 7,000. These folks are at nearly 16,000. That is an enormous number of applications for a class of 190 people. And they only interviewed 572 people. So there is a big, big, big cut that happens in the admissions process here, where Tulane is interviewing under 4% of the people who have applied. They have a lot of their class, nearly a quarter of their class coming from early decision and early action programs. They do have an MD PhD program, but it's very small. There are only 2 matriculants. However, they matriculated 11 international students and interviewed 26. Those are very, very healthy numbers. And you can see the other numbers for different demographics. The graduate debt is very high. So 290,000 is high relative even to other private institutions, but about 75% of students receive financial aid. One of the most interesting things about Tulane, as you can see, is that the ranges look completely different from Columbia. So this is a school that is getting, twice the number of applications that Columbia is, and its metrics for, its evaluation process is clearly not focused narrowly on these numbers. So as you can see, like the median numbers are not too far from national average, which tends to be about 3.7 GPA and somewhere around a 513 MCAT. But the ranges are huge, especially take a look at the science GPA, right? The 10th percentile is a 3.0 to a 3.96. That's a lot of people, like that range encapsulates a lot of different people and a lot of different academic histories. And so you as an applicant can deduce, right? Okay, these numbers are important, right? There is a range. There is a set of kind of typical GPAs and MCAT scores for this school, but it's very broad. And so it's clear that this is a school that's considering other factors, at least with the same weight as these numbers. So what are those other factors? I think you can look to the mission statement, which says we improve human health and foster healthy communities through discovery and translation of the best science into clinical practice and education. So communities and education really pop out to me, right? This is a school that's seeing itself as a part of a larger endeavor. You can also learn that Tulane has at least 10 student-run clinics that operate throughout the Gulf Coast. You'll see if you take a look at their curriculum and other aspects of the school that the commitment to public health is enormous. There is a very large public health school associated with Tulane University, but public health facing initiatives are very, very important. This is the second oldest medical school in the Deep South, and so their connection to the history of medicine in that region is very important to them. And Tulane operates clinical sites throughout Louisiana and the rest of the Gulf Coast. So they have long arms. They really do try to get to a lot of people who otherwise might not have a lot of access to education. So even though the school, again, is in an urban area in New Orleans, there are opportunities through the clinical sites and through the rural medical education program to have an education that really encompasses a lot of different kinds of geographic diversity. Okay, next school. Washington University in St. Louis. So a school from kind of the Midwest, middle of the country. And here again, we see another kind of different pattern. A little over 6,000 applications, and they conduct over 1,000 interviews, which means they're interviewing nearly 20% of their applicants. That's a very large number. And they're matriculating a class of only 124 people. So they're doing a lot of interviews, and it's clear that what happens in the interview process is very important for making their decisions. WashU does not participate in an early decision program, so nobody comes through a program like that. And they admitted of those 124 matriculants, 19 folks into their MD PhD program. It's one of the largest in the country. So that number, 19, that's a huge number for those of you who are thinking MD PhD. They interviewed 60 international students and matriculated 7. Those, again, that's a very large number of interviews for international students. You can see the rest of the statistics, and you can also see that the average graduate debt is only about $100,000, or was in 2022. 89% of students receive financial aid. As you can see here, there's again like not a huge range of scores, right? The medians are very, very high for this institution, and the ranges are a little bit broader than Columbia's, but they're also not gigantic ranges. So what we can learn from that is, okay, these numbers are pretty significant in the admissions process for WashU. What else we can learn? Things that come from the mission statement. I've just highlighted some keywords here. Again, innovative and leaders, creativity, right? They want people who are excited and looking to kind of do their own thing, right? They're looking for people who are really ideas forward people who are excited to try new things and have a record of leadership. As I mentioned, the average debt is quite low, and it's among the lowest student indebtedness nationwide, particularly for programs that don't have like a tuition-free policy. There's a student-led 500 Women in Medicine initiative that really seeks to uplift women in the profession. They don't require research, but 95% of medical students participate in research, and they do have one of the largest MD PhD programs in the US. So both of those things lead you to understand, okay, this is a place for people who really do like research. They offer a big SIB program where they match first and second year med students, which is awesome. There's a way to kind of get connected to the rest of the community outside of your own class right away. And the clinical sites that they use really do center on St. Louis. So there's not as much opportunity for kind of moving around to different sites in the country, but they do have some extremely well-regarded hospitals that are part of their system, and lots of opportunity for education within those. Okay, one more private school. This is Keck School of Medicine at USC. Again, here we see like a slightly different program. They're getting nearly 9,000 applications and conducting over 600 interviews, about 7.5% of their applicants, to matriculate a class of 186 people. They don't have an ED program. They do have an MD PhD program, but did not matriculate anyone into it in 2022. They didn't interview any international students. I believe their policy is that international students are considered on a case-by-case basis. Average grad indebtedness is, like close to average for private education, but a little high, although 84% of students receive aid. And you see here yet another pattern in terms of the metrics, right? So 517 and 3.81, 3.73 are the medians here. And there's a moderate range, it's not as big as the range at Tulane, but it's definitely not as narrow as the other two. And it's clear that people who represent a wide range of different kinds of GPAs, in particular, are coming to the school. The MCAT range is a little bit narrower, but the median is not so high as to be completely, astronomical. Things to know about Keck. This is a school where service starts right away. They have service initiatives that start beginning of the first year. They really emphasize that they work with a very diverse patient population in both public and private hospitals. They offer a curricular and co-curricular program that kind of deals with the intersections between humanities and sciences. So for folks who are really interested in the interplay of those things, maybe some of our folks who have majored or minored in humanities areas and know that you want that to be part of your career, a school with a program like this can make a lot of sense. They also place a ton of emphasis on student wellness. And so they offer a lot of options for students to interact with staff, with clinicians, and they consider health from a lot of different angles. So they're really vocal about considering the mental health, as well as social, physical, spiritual, financial, and academic wellness of all of their students. And that's really good if you are a person who knows that, like, hey, I want to be well supported. Okay. So that's the first set of schools. And I want to quickly go through some of these public institutions so that we can see, again, some differences. So this is the University of Connecticut School of Medicine. They got a little over 4,000 applications in 2022, about 11.5% of which were from residents of Connecticut. But they interviewed 57% of their interviews were 57% Connecticut residents. So as you can see, there's a huge boost for being an in-state candidate in getting to the interview process. It's not as big a boost in the actual number of matriculants, right? So you can see that like the percentage of people who interviewed is actually just a little lower than the percentage of people who actually ended up attending as Connecticut residents. They do have an early decision program, but it's not a productive one. They only had one person come in through early decision. So that's maybe not the most important thing about applying to this program. And they have a moderate sized MD PhD program. They do accept international students, but they interviewed a very small number. So it's not a huge vector for them. And average grad indebtedness is actually low relative to national norms. And you can see here, again, this is a pretty moderate pattern. These numbers are not too different from Keck. You know, they're pretty similar, or at least overlapping ranges in most cases. And this is good to know if you are a resident or if you're a motivated non-resident of Connecticut. Things from the mission statement here: discovery, education, service, innovation. They say we are committed to the belief that physicians are scientists. So definitely they want to emphasize that part of the learning. Nearly a decade ago, they shifted their curriculum to really prioritize team-based, problem-based learning, like we talked about earlier. And so if you're a person who's really interested in that kind of education, the school could offer a good fit. They also require longitudinal patient experience over the first 3 years of your curriculum. And they offer opportunities for students to serve as mentors to pre-medical students. They also sponsor a number of free clinics, including a migrant farm workers clinic that students can be involved with. Next up, Rutgers, New Jersey Medical School. So this is one of the two Rutgers schools. And as you can see, they got a nearly 6,000 applications, but about a quarter of those come from New Jersey residents. So it's a larger percentage, right? New Jersey is a more populous state than Connecticut. You know, there are lots of reasons for this. But so they're getting about 26% of the applicants are from in-state, but 68% of the people they interview are in-state candidates. And they're interviewing 13% of applicants overall. Again, there's a little bit of a bump up. So about 176 precisely matriculants, but 78% of the class is a New Jersey resident. Really important thing to notice here is that NJMS has an incredibly productive early decision program. The biggest chunk of those 79 spots via alternative admissions come through their early decision program. So for this medical school in particular, and probably no other medical school, honestly, early decision is a big factor. And if it's a top choice school for you, considering early decision can be a good thing. They do accept international students, but they only interviewed 2 and didn't end up matriculating anyone. Average grad indebtedness is pretty close to national median. And as you can see, the ranges are quite broad here. So MCAT median is about a 515, which is over the national average, but the ranges cover a lot of different scores. So do the GPAs. So there's a lot of variability in the overall GPA, but in particular, the science GPA shows a lot of variability, with the middle 50% being somewhere between a 3.53 and a 3.95. And again, that's a lot of people. What else to know about NJMS? What can we learn from other sources? Keywords from them: humanistic, culturally competent, integrity, ethical, professional, compassion. They care about human beings. This is a school where every adjective here is about how you interact with the world around you, like the kind of person you are. They are a school that is looking for people who are motivated as human beings to do good in the world and to be servants to the healthcare system and to their patients. They offer the oldest student-run clinic in the United States that a lot of students participate in. They offer very, very extensive service opportunities in Newark, and the curriculum emphasizes a lot of elective opportunities and a lot of flexibility. They also offer an accelerated 3-year primary care MD program. So if you're someone who knows that you want to go into a primary care specialty, you can save a year of medical tuition by going into the 3-year program. Next up, SUNY Downstate. Love to look at SUNY Downstate because it is our closest public school here in New York. And as you can see, they're getting about a little under half of their applicants are in-state, are New Yorkers. And we know New York is a very populous state. A lot of New Yorkers apply to medical school. But as you can see, 80% of the people they interview are from New York. So pretty decent bias toward New Yorkers. Ultimately, 87% of the class is from New York. That is, actually not the highest number, but it's definitely important to know. Okay, this is a school that cares about connections to New York, if not, directly state residency. They do have an early action and a BA MD agreement with another university. So some of their spots come from alternative admissions, but it's definitely not the biggest chunk. They do have an MD PhD program, but it's a fairly small one. They matriculated 3 people in their 2022 class, and they only interviewed 2 international students. So that's not a big vector of admissions. Average grad indebtedness is a little bit high for public education, public medical education, but probably that is largely due to cost of living things here in the city, in Brooklyn in particular. You can see, again, there's a pattern that's fairly similar to Rutgers in terms of the spread of the range for MCAT and GPAs, and the medians are relatively similar. So, this is a school that is taking a lot of people. It's considering factors that are not just these numbers. And so what might some of those factors be? Some of the keywords that I draw out of their mission statement: things like social institutions, competent, caring, advanced, research, strategies, and Brooklyn. They say that community engagement is a core component of their academic mission, and that comes out in a lot of partnerships that they have with local community organizations, nonprofits, government organizations. This is a place where they value connection to community. And so, they're looking for applicants who have those same values. This is a school where somebody who doesn't have a lot of service experience, somebody who doesn't demonstrate a real strong interest in urban medicine or experience with urban populations, is probably not as likely to be successful in the admissions process, because those are really key things for this school. They emphasize the availability of research options. They also offer a specialized career and professional development curriculum. So I think that's something relatively unique. As you're going through the school's curriculum, you're also able to learn more and sort of apply things to career pathways. They also offer some specialized pathways for particular kinds of interests that you can see here. One more. This is the Kirk Kerkorian School of Medicine at the University of Nevada, Las Vegas. And this is a newer medical school. So I wanted to bring this in also because this is a school from out west, and there are sometimes some different patterns when it comes to schools that are in the West, where the density of medical schools is lower. And also, this is an interesting case because this is a medical school that's in the West, but it's in a state that has a very low population. So they get about 1,500 applications, and only 20% of those are from in-state candidates. And they interview 300 people. About 60% of the people they're interviewing are in-state candidates. So it's very clear, like, that's a big boost for Nevada residents. They matriculate a very small class, and that's very common for newer medical schools. Usually schools start small and grow quite slowly over time. And as you can see, 88% of the matriculants are Nevada residents. They do not offer an early decision program or an MD PhD program. They don't accept international students. And average grad indebtedness is low relative to national numbers, but a lot of people receive financial aid, the vast majority. As you can see here, again, GPA spread is pretty broad. The MCAT median is lower than the national average for people who are accepted to MD programs. And, the GPA ranges are encapsulating a lot of things, which again means that they're valuing at least some other factors, at least as highly as they're valuing these numbers. So what can we learn about this school? It is the only medical school in the state of Utah, and it began admitting students in 2017. So it's been relatively recently fully accredited. But Utah is a state with a relatively low population. So there's not a huge population of people who are from the state who are applying. The way that they talk about themselves are as a transformational force for improving healthcare in Nevada. So again, they have a really particular mandate as a state school and as the only school in their state to serve that state and to create healthcare providers who are likely to stay in the region. They require community-based service learning in all 4 years. So again, that real strong connection to community, and understanding of, kind of the medical school as an institution that serves the community. They also have a lot of really interesting things like integrative medicine, well-being, nutrition, pain management are woven throughout the curriculum. So they're talking about these concepts not just as they're related to like the basic, learning about like the cardiac system, respiratory system. They're talking about them across all of the work that you're doing. In the most recent class in 2023, 43% of the people who matched into residencies went into primary care. So it's a big chunk of people. And about 39% of them stayed in Utah, 19% were in California. So the biggest chunk of people are staying in the Western region. And this year, they also introduced an initiative they called Learning Communities to help support students socially and academically. So this is something like a mentoring initiative, basically fostering connections between students, as well as between students, faculty, administrators. Okay. All right. So having seen all of these schools and sort of used these examples as illustrations, I think that, what I'm hoping you're taking away from this is that the differences in these schools really do come in the details. And you can learn a lot about schools based on the information that's available to you through some of the resources that we're going to talk about in this next section. And I think that it's really, really important to do what you can to try to, envision yourself in any of these places that you are considering. So when it comes to creating a school list, we've talked a lot today about the ranges of scores that are accepted, and I think that those are really, really important numbers to understand. Probably the most common questions that I get about creating a list are, related to how GPA and entrance exam scores will affect where you apply. I think that it's good to have a list that includes a mix of schools where your numbers are pretty close to median and some where your scores are above the median if possible. But it's most important to use the data about the ranges of accepted scores because those ranges are kind of like they're kind of like guideposts for you. Essentially, you can know for any given school, okay, like what's typical, what are the kinds of scores that are generally accepted. And so you can know if your scores fall within that range, you could be a plausible candidate from that perspective. And if your scores are outside of that range, if your scores are lower than that range, for example, it might be more of an uphill battle for you as an applicant. But I want you all to keep in mind that while GPA and entrance exam scores are sometimes limiting factors, they don't determine acceptance. So even if your numbers look really favorable based on a school, I also want you to consider all of these other factors that we've been talking about this evening. So, these things like, am I a person who's really, really interested in community service and community-based healthcare? Okay, I want to find that in a medical school because those are the schools that are going to be most excited about my portfolio. If you're a person who is really motivated to enter a career in healthcare because you are so interested in research, you want to apply to schools that really highly value your research experience. Putting all of the pieces together is a necessary part of this process. In terms of how many schools, with medical schools in particular, Barnard students have applied to a slightly higher number than I would like. Around 23 is the average. The national average is about 16. I generally encourage people to stick to somewhere between 15 and 20 for medical schools because it's usually really tough to complete secondaries beyond about 20 schools. If you're applying to other kinds of health professions, your number is probably going to be lower, just because people, like for example, dental schools, there are not as many dental schools as there are medical schools. So usually the list is a little bit shorter, but really it does depend on you and your interests. In terms of determining state of residency, check the school websites for public schools that you're interested in. If you think that there is a chance you could be a resident of multiple states, learn how the state itself defines residency because different states do it different ways. In New York, it's pretty simple. It's, you know, a relatively short, like a year period of continuous residency. In other states, you have to have a long record of having paid taxes in that state, for example. Keeping in mind, you can only be a resident of one state when you are submitting a primary application. So if you're using an application service, you're going to have the opportunity to list one state as your state of residence. However, if you are accepted to a public school, you'll probably have to go through an additional step of like verifying your residency in that state in order to have your, you know, eligibility for in-state tuition identified. Some resources that I encourage people to take a look at. So the ranges that I was showing you earlier, those all come from the Medical School Admission Requirements Database, or MSAR. I talk about MSAR all the time. If you come to my office, I'll probably show it to you and we'll talk about schools that you're interested in. It is a really good investment for the application year. If you're applying to DO programs, similar but not exactly the same information is available in the Choose DO Explorer. That's free. You just have to register to use it. If you're applying to dental schools, there is a print guide as well as an online guide that is a subscription service as well. And many, many other health professions offer online guides to various programs. This is what the MSAR looks like, just as an example, when you log in and take a look, and you can see there are tons of different categories of information you can see. I would also encourage you all to check out financial aid resources. I've linked here AAMC financial aid resources because, as I said, we have so many applicants to medical programs. But I encourage you to take a look at individual school websites, to see if they have info sessions. Those can be great ways to learn. Some of you may be concerned about things like rankings within the U.S. News and World Report. Those rankings have come under fire for a very long time, and recently different schools have kind of decided they will or will not participate. I think if you're using them, just do so with caution that the rankings are based on factors that may not track with your needs as a student. And then there are just some additional links here. I'll share the slides with everyone so you can take a look at these additional resources. But I would say, you know, my advice as you're going into the next stage is make sure that you're taking detailed notes on the programs that you're adding to your list, because it's really helpful for you to have that information later if you get asked a secondary application, or, you know, if you interview with a school and you want to be able to articulate why you are there. There are some resources here that are linked to help you out with that. And I'll just say finally, you know, it's really important to start with your own priorities. You know, consider your priorities and rank them. And then, you know, make sure that as you're relying on these online resources, they're imperfect, but typically necessary. Remember that your priorities may change as you go through the application cycle. So creating your list is not necessarily about identifying the exact school that you're going to go to. It's about giving yourself the opportunity to apply to a range of programs that are going to fit your needs and are going to be likely places that you are excited to attend. As you go through the admissions process, you'll learn a lot more about schools that may change the way that you're thinking about them and reorder them in terms of your own personal ranking, things like that. And I think creating your list effectively, really curating that list of schools to meet your interests and kind of match your values and needs and your kind of hopes for your medical education or your professional education. This is the best way to ensure that you're going to have a choice at the end of the cycle, and that it's going to be a good choice, you know, that you're going to be able to go to a program that you're really excited about. And that's what I want for everyone. Okay. So that's the end. I'm gonna stop sharing, and I know that I talked a ton, but I am happy to stick around for a few more minutes and answer questions if anybody has any.
Hi, Dr. Dye. I had a question about deciding kind of the spread of different schools. I know when we applied to undergraduate schools, we wanted like, maybe a third, a third, a third of like safety, like fit reach schools. So like is there something you have to suggest about that?
I would say that you probably want at least 50% to be schools that you feel like are a good match for you in terms of both like your metrics are pretty close to what's typical, like, sort of median for them, and you're a really strong fit in terms of like interests, resources, all of that sort of stuff. And then maybe, like 25-ish% for schools that you think like, my numbers might be a little bit on the lower end, but I'm a good fit. And I can really articulate well. And then maybe another 25% schools that you're thinking, my numbers are relatively strong for this school, but I also see a really strong fit. So it has to be, sort of, it always has to be good. And I don't really subscribe to the notion of a safety school in professional school application processes because it's just so different.
Yeah.
And the like things like, the range of GPAs might not, I mean, like it doesn't necessarily predict anything about whether that's the right school for you. So I think like making sure that the holistically the fit is there is super, super important for every application. So they should all be schools that you're interested in, that you're excited about, that you can articulate like why you're a good fit as the applicant that you are. And then, considering the numbers to kind of make those categories is a good second step, I think.
Thank you.
Yeah. Other questions? Okay. Well, of course, you can continue to ask me questions later, but I think what I'll leave you all with is just it's so, so important to think about what your priorities are and how you're presenting your candidacy so that you're going to find schools that are also excited about you as a candidate. If you remember anything from this presentation, remember that the numbers are not deterministic, right? They can be a limiting factor, and it's important to pay attention to what's typical for a school so that you can set your expectations as an applicant, right? If you're only applying to schools that have, metrics that are way, way higher than yours and you're not even within the range, that's important. You can do that. It's maybe not the smartest way to do it. But what I want you to remember is that having that fit be there in both places is always important for this process. And any school, it's easy for them to assess, MCAT and GPA and whether your numbers look pretty typical for their institution. That takes seconds. The rest of application review is like, okay, so who is this person? What would they bring to the table? How would they be as a member of our community? And so trying to imagine that for yourself, for every school that you're thinking about putting on your list is, I think, a really good way to proceed so that that you're curating a list of programs that you're excited about and that are excited are likely to be excited about you. They don't know you yet, but they will. So yeah, I think keep the fit on both sides foremost in your mind. And of course, keep me in the loop as you have questions. We will come back in about a month with our next program. So the end of March, we'll be talking about how to write about your experiences for the application so that you can demonstrate these qualities, these interests, these values of yours. So keep an eye out for that. And committee interviews start next week. So good luck to folks. I hope you all enjoy your interviews. Thanks for being with me this evening, and I'll see you soon.
Thank you, Dr. Dye.
Bye, everybody.